I think that dietary therapy can be very successful in the treatment of epilepsy in children, adolescents, and possibly also adults. And we see kids that go on the diet, and most kids we put on the diet have been on anywhere from 4 and up medications without effective seizure control. And in our experience, and in experience with the diet since the 1920s when it was developed, about 1/3 of the kids who go on the diet, very similar to that group of children I described, become seizure-free. And for about another 1/3 of children, there's at least a 50% reduction in seizures. So I think that makes the diet arguably the best treatment we have for refractory seizures.
So yeah, in general, about 50 to 60% of children will respond to the diet if you look at all comers. About 10 to 15% will become seizure-free. Most of the time you know that very quickly. One thing we're learning about the diet is that improvement happens very rapidly within 2 to 4 weeks of starting the diet. As I mentioned earlier, we know certain conditions seem to respond better than that. 70, 80% in terms of response rate and higher rates of seizure freedom. But most centers seem to find that. What's very interesting is all cultures, all ages, genders, family dynamics, religions seem to respond very similarly. It doesn't seem that that response rate is different for one group or another. The diet shouldn't be excluded to any one group over another.
I think in our center and in most other centers, overall about 2/3 of children are significantly improved with the diet. And these are children who have failed numerous anti-epileptic medications for the most part. So we're looking at children where another medication has probably a less than 10% chance of helping them. I think when we use the ketogenic diet in those children, the fact that 2/3 of children are significantly improved with nearly half of those actually being seizure-free is a real benefit.
When one asks the question, what is the success rate of the diet, you know, it depends on how you define success. You know, medical professionals say, well, if you've had a 50% reduction in seizures, then that's success. On the other hand, you know, you might want to say, our goal is to eliminate seizures 100%. Well, I think if you take the first criterion, which is the 50% threshold, I would say that 2/3 or more of the patients collectively in our experience have had a successful outcome, right? Obviously, if you want to push it higher and say how many have become seizure-free, our experience has been that it's basically center dependent. The numbers range anywhere from 10 to 30% or higher of patients who have failed medications subsequently becoming seizure-free on the ketogenic diet.
With the ketogenic diet at our center, about 20% are seizure-free, 60% have a greater than 50% reduction, and about 1/3 have no response. And it's regardless of, but there is certain seizure syndrome where the ketogenic diet works better, like the children with myoclonic astatic epilepsy, where about 50% become seizure-free. We reviewed the 23 cases we've had in the past 3 years, and it was remarkable how quickly they responded to the ketogenic diet.
The success of the diet is, again, it's a good question, and again, you cannot take epilepsy and think of it as one simple condition. So that the kids, the children, and some adults that we use the ketogenic diet in are generally patients that do not have a good prognosis for seizure control. So we're taking people that in general, children in general, are not destined to do well on anti-epileptic drugs. So even if you take this group, this kind of bad group as far as response to therapy, they do pretty darn well. And so we have about 50% of the children have a significant improvement. Seizure-free is 20–25%. And we rarely see children get worse on the diet. It really has a very good batting average. It's certainly, again, in a group of children that have difficult epilepsy, it's certainly better than any of the anti-epileptic drugs that are coming out, either the old drugs or the new drugs. So it looks quite favorable, and it tends to be effective and safe, and so it's a nice therapy to offer these children and their families.
The success rate with the diet, what we have seen from our randomized controlled trial, has been that around 40% of children achieve more than a 50% reduction in seizures, and around 10% more than 90% reduction of seizures. This probably is a lesser success rate that may have been seen from the previously reported cohort studies, but this was a definitive randomised trial with prospective review of the children. I think so in certain situations and certain syndromes, the success rate may be higher.
The success of the ketogenic diet is interesting because, like most therapies, it's really determined by who you put on it. And unfortunately, we still see a lot of kids who have failed literally almost everything before people think about that. But even in that group, we still are successful. We have about 1 in 10 that are seizure-free, and another probably third or so, maybe a little bit higher, that have improvement in their seizures. What we really don't know is if we used it earlier, would that success move up? It does with all of our other therapies. We think it should here. We don't have that knowledge yet.
I think when we look at success with the diet, I think traditionally we are looking at success in a population that has failed everything. So that when we talk about success, we're almost loading the situation against ourselves. But nevertheless, it still comes out superbly. I think we did one of the longer-term studies of it where we took 150 youngsters who had failed innumerable medications, 400 seizures a month, and we looked at a year because we wanted to know a long-term impact. We didn't. It was nice to know that somebody does well at 3 months, but you really want to know a year from now what they're doing over the longer haul. And what we found out was that about half the population came off of the diet by a year, and that's because it wasn't working. But if you look at the other half that were on it, the vast majority had a huge percentage of decrease in their seizure frequency, and it was clearly a better way to live than where they were before. So that I think I think it has a terrific success rate in a situation where you've set the odds against yourself in many ways. So I think. You've heard Millie Kelly say it a million times, that it's a rare parent who says, I regret having tried this approach. And I think we've got to be able to give people the chance to do it. So few regret that kind of a commitment and that potential opportunity to help their child I'm reluctant to use the word natural sort of way because it's hardly a natural diet, but certainly in a way in which the parent, I think, is able to really participate in making their child well. And I think that's a remarkable thing in itself.
Well, the service in my hospital started a couple of years ago now, and so we have had probably 30 children through the system. We currently are looking after 17 or 18 children on the diet. Most of those are doing really well. We've had some children who've been completely seizure-free within a matter of days on the diet. Other children have had to come off because the diet hasn't helped. And I think on the whole our results are comparable with those of other teams. I haven't yet managed to analyse all my data, but I think it's comparable. So what I say to parents when we're starting off is I would expect 50% of the children starting on the diet to do reasonably well and want to stay put, possibly even more than that.